Abnormally high blood pressure is called hypertension, and a person with blood pressure higher than 140 over 90 millimeters merchanks is considered to be suffering from hypertension. Around 1.13 million people have been diagnosed with high blood pressure throughout the world. It is one of the most common yet feared conditions, having long-term effects on your body and mind. If a patient faces enduring pressure of blood against the heart artery walls, it can cause several other problems like heart disease. What is high blood pressure? High blood pressure is a condition in which the force of blood flow against your artery walls is so high that it may cause health problems sooner or later. Blood pressure is found out by both the amount of blood the heart pumps and the amount of resistance to it in your arteries. When more blood is pumped in your heart and your arteries are narrow, you are suffering from high blood pressure. Uncontrolled high blood pressure raises your risk of serious health conditions that include heart failure and mitral valve disorders. How is blood pressure measured? BP is measured in millimeters of mercury, mmHg, and shows two readings, systolic pressure and diastolic pressure. Systolic pressure, maximum pressure during a heartbeat. Diastolic pressure, the lowest pressure between a heartbeat. The reading is written as systolic above the diastolic, for example, in 120-80 millimeters Merchank. Anything above 120 more than 80 millimeters is considered as high blood pressure, and below that is normal blood pressure. High blood pressure is defined as per a person's age too. For those who are above 60 years, 150/90 is considered high BP. What are high blood pressure triggers? A bad, unhealthy lifestyle like unhealthy diet, sedentary lifestyle, continuous tension or pressure, family history of high BP and being obese, overweight, a high BMI, are some of the factors that trigger high BP. Unhealthy lifestyle includes fatty food, consuming excess salt, smoking and excessive drinking, inactive lifestyle, constant stress, potassium deficiency. Types of hypertension, high blood pressure. High blood pressure is of two types: primary or essential hypertension and secondary hypertension. Primary hypertension. For many, mostly adults, there is no identifiable cause of high BP. This type is called primary or essential hypertension, which tends to develop slowly over many years. Secondary hypertension. For some, high blood pressure is caused by an underlying condition. This type is called secondary hypertension. Secondary hypertension tends to appear suddenly and cause higher blood pressure compared to primary hypertension. Many conditions and medicines may cause secondary hypertension, such as kidney problems, thyroid problems, obstructive sleep apnea, adrenal gland tumors. Certain blood vessels defects. You are born with congenital heart disease. Illegal drugs like amphetamines and cocaine. What are the possible symptoms of hypertension? Severe headaches, trouble breathing, irregular heartbeat, pounding chest, confusion, vision problems, nosebleed, fatigue, unusual chest pain, sweaty neck and ears. When should you consult a doctor? Once you reach a certain age, your doctor always does a thorough workup, including a blood pressure test, which evaluates your chances of suffering from hypertension. However, several patients are not diagnosed on time, so if you are facing sudden dizziness, severe headaches, congested chest, or irregular heartbeats, you need to visit the doctor immediately. So how to identify if you have hypertension? There are several cases where people with high blood pressure don't experience any signs or symptoms, even though their BP readings reach very high levels. In some cases, people with hypertension may have headaches, nosebleeds, or shortness of breath. However, these symptoms aren't specific and they may occur only when the blood pressure reaches life-threatening stage. Diagnosis. With the blood pressure machine, traditional or digital, your doctor or even you can measure your blood pressure. A normal person should have a blood pressure systolic 120 mm Hg and diastolic 80 mm. Elevated blood pressure confirms that a person is suffering from hypertension. Stage 1 hypertension. In this stage, the patient is diagnosed with mild hypertension if systolic pressure ranges from 130, 139 mmHg and diastolic ranges from 80 to 89 mmHg. Stage 2 hypertension. In this stage, the patient is diagnosed with severe hypertension, where systolic pressure ranges above 140 mmHg and diastolic ranges above 90 mmHg. Hypertensive crisis. This stage of high blood pressure requires medical attention. If your blood pressure readings suddenly exceed 180-120 mmHg, wait 5 minutes and then test your blood pressure again. If your readings are still unusually high, contact your doctor immediately. You could be experiencing a hypertensive crisis. How to prevent hypertension. Blood pressure usually rises with age. A healthy lifestyle can help you delay or prevent this increase in blood pressure. Significant actions include following a healthy lifestyle, regular heart health checkups, and if have high BP, adhering to the treatment plan. People with high BP can take precautionary steps to control it and diminish their risk of related health conditions. What is the treatment course for hypertension? Getting regular checkup. Taking proper medications. Participating in regular physical activity like walking. Maintaining a healthy weight. Avoiding or limiting alcohol intake. Avoiding tobacco intake. Eating a healthy and nutrient-rich diet. Avoiding excessive sodium. Stress control. Lifestyle changes. It is important to make some changes in our lifestyle to maintain healthy blood pressure levels. Smart and healthy is key for overall health. Stay stress-free and exercise regularly to stay fit. Cut down on sodium consumption and maintain healthy weight according to your BMI. Suffering from hypertension? Some effective tips. Work out regularly. Exercise at least for 3 days a week to keep your blood pressure in check. Aerobic workouts such as jogging, walking, swimming, cycling, and even dancing are all good to keep your BP under control. Watch your waistline. Having too much weight around the waistline increases the risk of high BP. So, it is important to lose weight to keep your blood pressure under control. Quit smoking. Smoking raises your BP for many minutes after you finish it. Quit smoking if you smoke to help your body to restore normal blood pressure levels. Eat a healthy diet. Make sure to add more of vegetables and fresh fruits in your diet. Add more of potassium-rich foods in your diet. It helps in decreasing the effect of sodium on the blood pressure. Foods rich in potassium include peas, bananas, spinach, avocados, mushrooms, sweet potatoes, cucumbers, and oranges, to name a few. Cut back on tea or coffee. Tea or coffee can raise the levels of your blood pressure. Limit their intake to keep your blood pressure under control. Manage stress. Stress is a significant factor that contributes to your high blood pressure levels. Adopt hobbies to take less stress or simply change your attitude towards it. Yoga and meditation are said to be good ways of reducing stress. A person living a healthy lifestyle, even diagnosed with hypertension, tends to live longer than people avoiding medical advice. Thus, in order to live happily, maintain normal blood pressure. For more information and complete checkup regarding hypertension, consult your doctor.